On a Sunday, what's Cap? Well, it's Brett, Doc Jody, Doc Steve. We'll get Sal Barbaro on a Sunday show. We didn't have a chance to do a Saturday show, so we thought we would sort of congregate with everybody. And then, of course, we get blindsided that now there's been a little change in the presidential race. You read about that, Stephen, didn't you? Huh?
No, I haven't. I have been neglectful of news.
Of news, right?
Brand new information.
Jody's got it.
Biden dropped out. But, we talked last time, we talked about Parkinsonism. And it looked to me like just watching him walk, watching his expression, watching his falling, the sort of hesitation that he had just about thinking in general. And then a couple of times I saw a tremor like this, a quick tremor. It was not obvious, but it happened a couple of times. I went, wow. I mean, that's got to be the diagnosis or part of the diagnosis that they are entertaining with him. And Parkinsonism, as we spoke about before, tends to be progressive. About 30% of people have dementia. So he had these things on the horizon, and finally somebody talked him into quitting. I think it was the right thing to do. I'm not saying that from a political point of view, but just from a human point of view. I was thinking, here's a guy that's going to be getting worse. He's going to be suffering more. He's an old guy already. I think it was the right thing to do. I'm not sure he's endorsing the right person, but somebody else going to figure that out at the convention, I suppose. But Steve, what do you think about that?
I think
the right thing here.
I think that at his age, the rigors of the duties of the president are very, very strong. And either for both of the candidates, both former President Trump, who's about the same age, and President Biden, the rigors of running the country and keeping people appraised of what's going on is something that Taylor Swift can do, but I'm not sure these old guys can.
Yeah. I tell you, it's a sad thing for him because, gosh, he has been involved in our government for a long, long time. But as a country, we have to have somebody there who is sharp. I really believe that. Somebody who can think well, somebody who can plot things out, and someone who is able to discuss problems with leaders of other countries. And I don't see his ability to do that. Now, the odd thing is, and I think something that's still hard to explain, is that there have been moments when he seemed pretty sharp. If he had a text in front of him, if he had preparation, it looked like he could, you couldn't tell for sure whether he had any problem or not.
Yeah, and let's bring Sal Barbaro, and Sal in from San Antonio. We're talking kind of Doc, we're talking about medically, you guys were talking about it last week, the cognitive ability of not just a Republican or a Democrat, a president. And Sal, what from San Antonio, good morning. What's your thoughts on this big political move this morning?
I think, to be honest, he should have done it a while ago. It's sad. He, whether you like him or you don't, he is the president of the United States, and it's sad to see somebody, whose mental capacities have somewhat decreased. But like it's all going to happen to us, and I wish him well. I hope he, whatever years left God has going to give him, I wish him well, and I hope he enjoys it. And but I think he's doing the right thing. You could just tell that, I don't think he had any form of dementia, but he was just, you could see that his mental capacities have slowed down. Even the way he walks and turns have slowed down. And, you're talking about running a country, and, maybe he felt he could still do it at this age. God bless him. But the real question now is, whoever the candidate for the Democratic Party is it too late? Has the country already made its minds up, and is there whoever the person is, and it looks like it's going to be Harris, is she going to be able to unify that party and beat Donald Trump in the fall? It's to be seen. But it's sad. I mean, I wish him the best. I do wish him the best.
You know, the thing that I noticed first, and this is 2 or 3 years ago, was his walk, his gait. You know, he
Yeah.
had the classic walk of somebody who has Parkinsonism, I thought. You know, just looking at him and the way he fell and the trouble he had getting upstairs, it's just gotten to be worse and worse. So anyway, I'm like you. I wish him luck. I hope that whoever takes over the presidency in his absence does a good job and that we can all support that person. And that's the way it has to be. Now, Sal, you're on vacation and you sent us a couple things. One was the running of the bulls. Did you do that?
I did it. I did it. I don't know if I sent Brett some pictures and I sent him a video.
Yeah.
So it's held in it's held in various places, but the most famous one is Pamplona, Spain, which is about 4 hours north of Madrid, and they hold this this weekend. Yeah, that's people running, and you're going to see the bulls coming down. So I learned that, by the way, that bulls can't turn, and make a sharp right or sharp left. They veer off. So
Right.
you can guarantee, I can tell you what side I was on.
Okay.
It's held from July 6th to July 14th, no matter what day of the year, what day of the week it falls on. It's held during the Festival of San Fermin,
Right.
who was the Catholic saint. I was in there. Brad, I sent you a picture of me finishing the race.
Okay.
Those bulls run about a distance of about 0.5 miles into the stadium. At 8 o'clock, you hear this big bang, and you could just hear the emotion of the crowd. And there's just so many people there. We're all dressed up in classic white with red bandanas. I kept, there I am. I kept telling myself, what am I doing here? I wasn't sure that my life that was a no-no for them, but I made it through. And the funny thing was though, I go to this guy and I said, we made it through, and he tells me in Spanish, he says, well, there's another pack coming behind this one, and it's smaller bulls with cowbells on. And sure enough, as soon as I said that, they passed me by. But it was kind of fun. You have to run. The problem is really not the bulls. There are guys who go out there, you're going to see in the middle of the pack, that are trying to touch the bulls and run with them for a short second or so. The key is really just not getting clobbered by the people and tripping over. And,
right.
You learn how, if you fall, you quickly move to the sides as fast as you can, cover your head. But it was, you get there about 6:30 in the morning. Yeah. Now this was my favorite place to go into in Spain. This is a picture from a park of the Basilica de la Sagrada Familia, which has been under construction since the 1880s.
Wow.
It's had like 15 architects or 15 sculptures. You go in this thing, it's massive. It's bigger than St. Patrick's, bigger than St. Peter's in Rome. It's absolutely gorgeous. And so I went to, I was in Rome, I was in Barcelona, I was in Madrid, I went to Pamplona to run the bulls, went up to the Guggenheim in Bilbao. And then the wife went over to St. Sebastian. I came home and I had to work, but it was
Well, hey, you know what? Running of the bulls, my son did that. And he was out of college. He was in his late 20s, I guess. And he knew that I was worried about the running of the bulls, because every year there are a few people who get killed in that event. And I don't know how many, and I don't know if it happens every year, but it certainly has happened in the past. People fall, and every once in a while, a bull will take a crazy turn. So anyway, Paul called me after the race was over, and he said, "Dad, I ran with the bulls today." I said, "You did? Holy cow!" And he said, yeah, he said, I stayed up all night with these guys and they were friends of mine. And, I met them somewhere. And then I ran with the bulls. And he said, only one crazy thing happened. He said, he had this same idea that you're talking about, go to one side, if something changes. And he said a bull in front of him just turned around and kind of came at him. And he dodged the bull and it ran into a fence. And I guess it just crushed this fence. Then the bull turned around and ran off. And he said, so he thought, okay, I'm done. I made it. And just like you, he looked around over his shoulder and here came the second running of the bulls, the small bulls. So are those small bulls dangerous, Sal, or not?
They could be a little dangerous. They weren't as big or as, I think their horns are sewn down a little bit. I think it's just the people want to learn to run for that group. But they do it 7 days in a row. They run at the same time for 7 days every morning. It's the entire town is basically on vacation for that 7 days.
I would hope so. Yeah. And let me ask you right now, what do you think the fatality rate since 1910 is? How many people, ballpark, everybody guess this. I'm looking at it. Since 1910, 7 days, how many people have died? Give me a number, Sal. What are you thinking?
For total since 19 something?
Since 1910, yeah. How about only 16?
30.
16.
I was going to say 30.
Yeah, 16 is the title. I'll just to push up there, but they say on average annually when it goes down south, 200 go to the hospital.
Yeah.
I thought the number was a little higher than that. When my son did it, I was going, wow. I was thinking, what in the world? I'm glad you made it, but then what kind of risk did you take? And I thought it was I thought there were like a few people, maybe 4 or 5 every year, who somehow died in this race. And some people have a hard time running hard or pretty hard for half a mile. That's a pretty good race for a lot of people. So I'm glad
they won't catch the bulls, but the problem is, like I said, the people just trying to not fall down or get stampled over, or like I said, you're trained. If you do fall down, you scoot yourself towards the side and cover your head. I would imagine every time they run that 200 or so, probably the number that actually get gored by the bull or something is probably even low, very low. Also, it's probably the people. I watched people fall in front of me. My father-in-law at 88 decided he wanted to run it, and so this is a guy who basically is he's still pretty good. But he's on a blood thinner. He was on Eliquis, and I said, I told him, I said, John, I said, you really think it's a good idea that you be out there running, while you're on this blood thinner? Because if you get hurt, there's gonna be some serious bleeding. And he didn't care. He's done it now 4 or 5 times. So this was the interesting thing. So he ran it, and of course he tripped. He got tripped, hit his knee, and he's got this big hematoma on his left knee. The police came out, of course. They wanted to. You're not allowed to run with glasses or any hat. This is so, and you'll know why. So they came out and they asked him, how old he was, and he said he was 88. They took a picture of him and told him, you will never ever run this race again. And it's all facial recognition. You have no idea. In that crowd, they have cameras galore. That's all facial recognition. So they know exactly who got hurt, what happened, up and down that street. Like I said, it's a half a mile run to the stadium. Once they get in the stadium, there's a whole group of people there waiting for the bulls, and you have a massive matador with the bulls that are in the arena. Quite a spectacle.
Yeah. Hey, I'm glad you made it out safely, and you can live to tell.
I'm not going to do it again. I'm not going to do it again. That's another one off my bucket list. I dove down 100 feet of water, with scuba diving. My last thing is to jump out of a plane. I'm going to do a tandem jump. And that'll be it.
I never had that one on my bucket list, I'll tell you. But what a thing. Steve, would you run that race if you were right there at 28?
No. No.
No.
However, if I was the age of your son and I was with I'm going back to last week, all the blokes all the my friends, and I wanted to fit in, yes, my judgment might go away, and I might try it in that situation. In my situation now, I just know that's dumb.
I want to mention one thing, Dr. Galichia, since this is a heart show and a health show.
Yep.
I did send Brett a picture. This was what got me most amazed about Europe, Italy. But I looked at the crowd, and there were thousands and thousands and thousands of people. If I told you I couldn't find one fat person, one person who was obese out there, if I did the same thing, this is going to get me in trouble in my hometown here in San Antonio. I did the same picture. Antonio. There was not. I mean, I kept looking at the people that were in their 80s and 90s out there. I was looking around all the kids. I was looking at the middle-aged adults. There were very few. I mean, I could probably count them on my hand if I was looking at 1,000 people that were obese. And that to me was one of the amazing things about going to Europe, and was what I was most impressed with. Their dietary, the elevators are not that common there. They walk up, their houses, they have stairs, they walk up, and I was just so impressed with that. I don't know if you kind of saw the same thing, but that's what I was very impressed with.
I've always been impressed by that. They don't eat the quantity of food that we eat, for one thing. And I think that makes a big difference. And the other thing is that they tend to have like a longer lunch, maybe spend even an hour and a half to eat lunch. And then they go back to work, and they have kind of a late dinner and a smaller dinner than we have. And I think that has an effect on their weight. Plus the fact that they tend to walk more, instead of just driving everywhere. Many of my friends over there, they'll just walk, they'll walk a mile or 2 miles to go and have dinner. That, I think that helps them as well. And they also drink a little bit. A lot of the people that I am around there drink a little bit of wine, but not a lot. So they're not drinking a whole bunch of beer or whiskey or something like that. They tend to have wine. Maybe even for lunch, they'll have a little bit of wine. Then they have a little tiny bit of wine for dinner, but that's it. Now, God knows. I mean, there are alcoholics all over the place there. And there are obese people as well. But that is one thing that you notice, that they tend to get more exercise, and they do tend to eat less quantities.
Yeah, Sal, you started with this list here. Tell us what relevance this thing. I don't know if you can see full screen, but we loved it, of kind of some dietary things you're talking about.
Yeah, basically. So we wanted to talk a little bit about heart failure on this show, and I wanted to bring up basically the dietary patterns that you would see that would cause heart failure. So let's first define heart failure. So there's basically 3 types of heart failure, what we consider heart failure. There's heart failure, what we call preserved ejection fraction. There's heart failure with moderately reduced ejection fraction, and heart failure with reduced ejection fraction. The ejection fraction is the amount, roughly a number, it's a percentage that the heart puts out for each beat. Normally, it's around 50 to 70%. So, if you put 100 cc's in fluid in the heart, it would every beat, it would take out somewhere between 50 to 70%. So when we say heart failure with preserved ejection fraction, you can still have heart failure, which means fluid builds up on your lungs and you get short of breath. It's clinical signs and symptoms. But, you still have a preserved heart that's functioning well. Then I said the other end of the spectrum is most of the ones that we see and we deal with every day is heart failure with reduced ejection fraction, called HFrEF. And it generally is when the ejection fraction gets down to like 20 to 35% or so. So yeah, there you go. So those are the types. And so this is the first thing, if you look at the dietary patterns of what causes sometimes heart failure, it's going to cause high blood pressure and diabetes, which are known risk factors for heart failure. You could see the bad things, right? They looked at, various things like, fried foods, processed foods, things with, high fat dairy contents like eggs, high sodium content, things like that. And you look at versus the stuff that doesn't. Like, for example, if I have a sandwich, I'm going to be putting it on whole grain bread with 4 grams of fiber, etc. The DASH diet, I think we've talked about on our show, the diet against systolic hypertension, which is really not a diet. It's just a general good eating way for you to eat. Of course, if you're going to have, we try to avoid red meat, mostly chicken, poultry, and fish. I always found it interesting about chocolate in there, believe it or not. But it made the grade. But that's basically some of the things that cause, or some of the things that start to have an effect on people with heart failure. And again, most of the symptoms of heart failure, Dr. Galichia, we see it all the time. People complain of shortness of breath. They can complain of shortness of breath when they're sleeping at night and they have to sleep with a couple pillows to have the bed inclined. We call that orthopnea, or where they wake up in the middle of the night short of breath. We call that paroxysmal nocturnal dyspnea. Sometimes when they bend over, bendopnea, so-called, and then they stand up, they get short of breath. The signs, of course, would be, they have rails on their lung. Chest X-ray shows rails, or fluid on their lungs, basically pattern. You can see an elevated jugular venous pulse. That's the vein here, the jugular vein. That if the system gets backed up, you see an elevation in that. You can get fluid in your belly, of course, and then you have fluid in your legs. You get edema or swelling in your legs. These are the symptoms besides shortness of breath. Then there's there's laboratory variables we could someday go into, but this is our mainstay about heart failure. And so we have a slew of drugs which have now been approved to battle heart failure, and we could go into that if you wish.
Yeah. Well, one of the things that happens is that people often have subtle symptoms in the beginning. They're a little short of breath. They have swelling. The swelling may not be profound. And one of the new symptoms that's been reported is that in early heart failure, people will notice they get short of breath just bending over, like to bend over to pick up something off the floor and go, I'm short-winded. And so that's something that you have to be aware of. And those two things, edema and shortness of breath on exertion. And then, Steve, one of the symptoms is becoming short of breath at night.
Mm-hmm.
And having to sleep on pillows. That helps get the fluid out of the lungs. And then those same people may wake up short of breath. We call that paroxysmal nocturnal dyspnea. And that is a significant symptom. If you have a symptom like that, you really need help right away. Steve, you've seen a whole bunch of people come to surgery. Did you always, you wanted to make sure they didn't have heart failure, even if you did an abdominal surgery, right?
Absolutely. Absolutely. And the things that Dr. Sal mentioned is the first thing the surgeon is going to look at is the swelling in the legs. Number 2, check the abdomen, see if there's ascites or fluid there. And then listen to the lungs. He said listen for rales. And then look at the jugular veins. And listen to the history. If the surgeon is concerned about this, it's really wise to get an echocardiogram on them before operation to see if they're in good shape.
Yeah. Sal, one of the things also that's been written about a lot lately, and this is a worldwide problem, and that is that people will go to their family doctor and they'll have some of these symptoms. I'm a little short of breath. Well, I'm having something, swelling. And so the doctor will say, okay, I'll get some tests. And then it might take months or at least weeks to get a test like an echo. Or they may say, well, I don't do that test in my office, so I'm going to send you to a cardiologist. And even in our state and in our cities, right where we live here, it may take a few days or weeks to get in to see a specialist. It's like it's very much a big problem. A big problem in Italy. It's a big problem in Britain. Sometimes in England, they're saying, if you have the symptoms of heart failure that we just talked about, and you see your family doctor, it may take 2 months before anybody does a test on you, like a chest x-ray even, or an echocardiogram test that ascertain whether or not your heart is beating well or not. Something that you got to know if you suspect heart problems, especially heart failure. So how's it in your city? How's that in San Antonio? Is it hard to get in to see a specialist?
I think we're running about the same with everybody else in U.S. and worldwide. It doesn't happen right away. I mean, if you're so short of breath, you need to go to the emergency room, and that's where we'll start figuring it out. You'll get tested right away, but I don't think everybody needs to go to the emergency room. Just to show you how important heart failure is to the U.S. I mean, we don't have that statistic right now. I don't know, Brett, but it has what they call its own DRG. In other words, it just like sepsis does and stroke does, and it's one of the major where we spend the most amount of money on in the U.S. treating heart failure, and whether it's the various types, whether the heart's normal, whether it's not normal, whether it's structural heart disease. I think, Brett, I have a slide there I gave you with the American Heart Association classification. But from our point of view, yes, it requires, like I said, there are other tests that we do. Generally, an echocardiogram is one of the first tests that'll be done, along with general blood work. For example, a CBC, thyroid function test, a chem profile, a BNP level. That's the pro BNP, which is the N-terminal BNP beta natriuretic peptide. It's the white count for heart failure. If that's up, it generally means you have heart failure. These are some of the symptoms, of course, we talked about, and that you could see. It just depends the spectrum. It could be from minimally symptomatic, where you're just having a little bit shortness of breath, and then where it gets really bad, where the blood pressure goes down, you become extremely cool. And you're cool and wet, as they so-called, is the worst situation. It means your heart's barely functioning. You can develop fluid in your cavity. But those are the tests that we generally start with. And once we diagnose heart failure, then we have to go find out what are the causes. There are a lot of causes for heart failure. There's some that, the most common cause still today is coronary artery disease, ischemic what we call ischemic cardiomyopathy. That's the most common cause, but there are other causes, especially one of the more ones we're starting to put a lot of emphasis on these days is amyloidosis, amyloid heart. We see that in the elderly population. People in their 70s and 80s, all of a sudden saying they're short of breath, and their heart becomes stiffer and not able to contract as well. And it's because of these fibrils, these protein fibrils that are deposited in the heart. They're called amyloid fibrils. There are, like I said, there are other causes. You could have a dilated cardiomyopathy where the heart arteries are fine, but the heart enlarges and loses its function secondary to a viral illness. There's, like I said, 10 or 15 different possibilities that can cause heart failure. Alcohol can cause heart failure. You can get heart failure from low thyroid. There's, like I said, multiple other causes. So the workup is usually intense. A cardiologist generally is the one who usually starts the workup. And then how we treat it depends on various what type it is and how long the process is going on.
Yeah, I think one of the most important things that's come out of some of this recent literature is that early treatment may save your life, number one, but also it may prevent the progression of heart failure to the point where you're disabled, or it will shorten your life because of the progression of it in a profound way. So early diagnosis is important. And that's why, in Europe, they're complaining bitterly about the fact that they can't get these tests. And sometimes if they get a test like an echo, they go somewhere and they get an echocardiogram, but nobody looks at it for weeks. And then finally it gets called to the doctor and he goes, yeah, you got heart failure. And so we have some of that here. In various parts of our country, it's hard to get testing of any kind, and it's hard to see a specialist in many areas, even a cardiologist, Sal, sometimes. So getting early treatment is really, really important. And, it's something that often gets overlooked. And Steve, if somebody came to you and they said they were short of breath on minimal exertion, that's kind of a no-brainer. You're going to look at that right away, right?
I am. And previous, 20 years ago when I was in practice and saw a lot of older people in my private practice, I would ask for and get an echocardiogram, and we could get it reasonably quickly. These days we can't. I have a granddaughter that just finished training for vascular sonography and who does these types of tests. And to get scheduled, like you said, if it's not emergency, it may take a week or two. And then the concern that nobody looks at it is, I think that's bad.
Yeah. Well, we had an instance in our family where a family member died, and he was short of breath, and he was severely short of breath. So he went to see a doctor. He was referred to a cardiologist, and the cardiologist did an echo. And the echo was done correctly and pretty much on time. So then on the weekend, the gentleman died. He passed away of heart failure. So the family went back and said, what did it show on the echo? What did that show? And the cardiologist said, well, I haven't looked at it yet. And it was like 10 days later, 8 days later, which really, really upset the family. But the cardiologist was saying, hey, I got a zillion of these, and this wasn't somebody who was known to me to be acutely ill. So I just didn't have a chance yet to look at it. So then when he looked at it, he said, oh my gosh, one wall of the heart is beating so badly. And he said, I'm just sorry. I'm very sorry that I didn't see that. But he said, I just didn't get a chance to look at it. Wow. So that's another problem. Overworked doctors and, a difficulty just working things in. Or maybe it wasn't brought to his attention right away. But Sal, often a tech will come to you as a cardiologist and say, look, I just did this echo and there's something really wrong. I want you to look at it now. That's a smart tech, that understands that. But many people don't have they don't do that, or they don't feel like they know you well enough to show you something right away, and it may sit there.
Yeah. Well, so yeah, I know we're running out of time, and so I was thinking maybe in the next show we could possibly go over the medications that are currently out there, and the devices. There's devices now out there for heart failure, and how we monitor it. There's implantable devices. So maybe we can do that next show.
We are, and I think it's important. I thought we'd get to some of that today, but we did not. And thank all of you for watching. Thank you guys for being with us. And Sal, next week, we'll talk about the treatment of heart failure, early treatment and treatment when somebody really gets sick.